Doesn't look like we're gonna get any free tickets.
Yeah, I was hoping for
No tickets.
All right, we got 9 o'clock.
free tickets. Yeah.
Are you guys ready? I'd like to call this meeting to order of the Public Health Committee, Wednesday, June 16th, 2021, time being 9 a.m. I am Chairman Jared Sanchez. Clerk, could you please call the roll?
Silva? Lewis?
Here. Silva is here.
Silva is here?
Yes,
Thank you.
you're welcome.
All right, we can't even hear.
Shepro? Strathman?
Strathman here.
Debbie?
Duffy here.
Sanchez? You have a quorum.
Okay, can I please have a motion and a second to approve the minutes of May 19th, 2021?
So move.
Strathman
Moved,
seconds.
Strathman seconds. Any comments, additions, deletions? Hearing and seeing none. Clerk, please call the roll.
Lewis? Shepro? Strathman?
Strathman, yes.
Debbie?
Duffy, yes.
Silva?
Silva, yes.
Sanchez?
Yes.
Thank you.
I think Mr. Shepro informed us previously that we can get a consent for that.
Can we
But
call him?
yeah, let's give him a call. No, please don't. Okay, finance. Does anyone have any question about the financial reports for the Public Health Department this month? Anyone online? All right, we'll move on to public comments on agenda items, and we'll take public comments on non-agenda items as well if there's anyone here for that. I don't see anyone here. I don't hear anyone online, so we'll move on. Animal control. Brett?
Good morning, everyone. How are you today?
Excellent.
Animal control only wants to report we had another very successful clinic this last Saturday. Thank you to everyone who helps us spread the word. We've already passed our 2019 numbers, which is fantastic. We've given out 75 microchips, seen close to 242 dogs and 70 plus cats. Sorry, I don't have the exact number in front of me. I'm sorry about that. It's going very successful. People are really, in this tough economy, it's a time where these low-cost clinics have been fantastic. They're really appreciating what we do. People could not be nice enough. Most of them have to wait an hour to 2 hours to get through, and that's with us running 2 veterinarians. But it really has been a huge success in this county, and every year continues to grow and grow. So that's fantastic. Our next clinic will not be until August, and we'll talk about that as it gets closer, as we take July off just due to holidays, vacations, and everything like that. Only other thing I have to report this month is expenses did exceed revenue, which was expected. With some of the vets have not reported to us yet their tag fees, which it's still a little early in the year. Those will start rolling in as we get closer to the end of the year for the money. We are fine though. We have enough in reserve. This is why at the beginning of the year we count our pennies, knowing that these months are ahead of us. So we're very cautious to do these sorts of things. Wasn't by much, but it was a little bit, and I like to point that out to the board just so everybody knows that it's being very closely monitored, and we watch our money very closely as we try to ensure we're never a burden on the board. That's all I have this month, if anybody has questions for me.
Mr. Tepe.
Yes, Brett, I wanted to make sure that you were still keeping those rabbits separated.
Sure.
Anyone else have any questions or comments? All right. Okay, we do have a resolution under animal control. Can I get a motion and a second to discuss and potentially pass this resolution?
Strathman moves.
Strathman moves.
Silva second.
Silva seconds. Okay, Brett, could you run us through this, please?
Yeah, I'd love to. In the last 10 years, animal control has not adjusted their tag rates. Every county in the collar counties has. We've been very tight budgeted as close as possible to ensure we remain as one of the lowest county numbers. And the other thing, we're the only county that does these free tags to seniors. That's between $40,000 and $50,000 of our budget every single year that we give out for free. We want to ensure that that service, especially to our seniors, continues. We want to ensure that we continue with the dollar transfer fees. The programs we run here, we're doing more and more. Since I've taken over in the last 7 years, we have done so much. These vaccine clinics are a perfect example. Unfortunately, we're just reaching the end of that 10-year threshold where, especially with Budget Resolution 20-428, where we need to start looking to how can we prepare for the next 10 years. I want to make sure we do this in a very calculated way. I want to make sure we do it in a way that we, as minimal as possible, impact our community. From running our calculations, one of the ways of doing that was a $2 raise to our non-neutered tags and a $2 to our neutered and $5 to our non-neutered. This will allow us to continue to offer these free tags to seniors, which again is that hardest hit community. We want to ensure that we're protecting them as much as possible in this county. This will also allow us to continue to be one of the lowest collar county tag fees around and continue to offer services that other counties are not. We're very proud of this. So that's where we came up with these numbers to hopefully get us through the next 10 years, because what we'd hate to do is put through a tag fee raise now, come back to the board in 2 years and say, hey, it wasn't what we thought, or in 3 years, 4 years. We want to go for at least another 10 years, if not longer into the future. So we really tried to think this out to ensure that animal control is being protected in the future and not a burden on this community or the county.
Excellent. Thank you, Brett. Does anyone have any questions? So you're saying we're still going to be one of the lowest fees in the Collar County area?
Correct. And of the top 5 counties, we will be the lowest. But we like to look at everybody in the collar counties. This will continue to keep us the lowest. And considering that everybody just raised their tag fees, we know recently, so we know we're the last county to do this. So that means everybody's going to be raising their fees before we will even have to touch it. So again, that's going to continue to keep us at the lowest. And again, we're the only ones in the collar counties, and Cook County included, that offer these free tags to seniors. And that's a program we really want to ensure we protect closely.
Thank you very much for putting this together. Does anyone have any questions? Madam Chair?
Yes, I do. I love the fact that you're helping out seniors. I've got 2 questions. What do you consider a senior? 60, 55, 65, 70? What's the age?
It is 65 years of age and older.
65. Okay.
I've been missing that for all these years.
Missed
Can't
opportunity.
count all your houses.
And then how many, you mentioned $40,000 to $50,000 that we are using to support our seniors. How many dogs and cats is that?
I would have to run the numbers for you. It does vary every year. We need to remember that some people that purchase those 3-year tags only get a tag every 3 year versus those people that get a 1 year. New puppies have to get a 1 year before they can receive a 3 year. Our numbers do fluctuate year to year. It's very difficult to exactly. That's the reason my estimate is between 40 and 50,000. If you would like numbers of the last 3 years, I'd be more than happy to get those for you.
I'm just curious.
I could definitely get them to you if you'd like.
That would be great. Thank you.
Of course, yes.
Okay, if there are no further comments or questions, clerk, could you please call the roll?
Lewis. Shepro.
Yes?
Strathman.
Yes.
Pepe.
Pepe, yes.
Silva.
Silva, yes.
Sanchez.
Yes. Okay, thank you, Brett.
Thank you.
All right, we'll move on to the executive directors section. Kathy Foster, would you please lead us through this?
Yes. Can you hear me okay? Okay. One of the things before I go into the strategic planning presentation?
Or pull it a little closer. Some of these mics aren't as strong. Yeah, make sure it's on.
It
first.
looks like it's
I think it's on.
green.
I hear it coming through those
Okay.
speakers. but-
Yes. So one of the things that I wanted to let you know is our data and quality coordinator who was just hired, I asked her to put together a survey and that she's going to be sending out to you all to see how you would like some of the data or health data presented for future meetings in case you guys, basically what format and what you might, some topics you might want to, us to bring forth. So that should be coming out shortly after this meeting. So I just wanted to say, please, it'll be very short. It won't be a hour long or anything like that. It'll take you about 5 minutes, 10 minutes tops. So I just wanted to let you know that was going to be coming out. Okay. So our King County strategic planning cycle is going to be coming to an end. It's 5 years. And it will be coming to an end at the end of this fiscal year, November 30th, 2021. So we need to plan for a new 5-year strategic planning cycle. I think Blair is bringing up the presentation now, so. So I know all you know what a strategic plan is. Basically, it guides us. It's a map that will guide us forth to, there we go, to make decisions and make sure that we are moving on the priorities that we need to. So I'm sorry, next slide. Okay, so for the strategic plan. So there's the purpose, to serve as a leadership tool for communicating. I call it like a map guide. Everyone has their own way of describing it. And the importance of this too is this needs to align with our community health improvement plan. And we just got reaccredited last year, so this will align with our accreditation and the standards. And then it will also align with our quality improvement and performance management plan. So we will make sure as we develop it that it matches with all that. And we use data points in that when we're developing the new 5-year cycle. So the timeline is going to be beginning now. So we're going to be having our kickoff meeting in a couple of weeks. So we will have, so our team will be internal, King County Health Department, we'll have leadership, we'll have staff, we'll have, I believe, Public Chair Sanchez is going to be able to come, and Co-Chair Silva, Dr. Silva is going to be able to come. Everyone will still get to be able to have input in it because we do an environmental scan. So I just want to make sure that you know that. But this core team will, put everything together, and I'll explain that in the timeline that will be coming up. So generally, we have about 5 meetings, so it'll be over about a 3-month time. And then we will be bringing forth to you come November. Yes, I just want to make sure. The November Public Health Committee meeting, or no, I'm sorry, October, because it has to be approved by county board by November. So I had to think about that. So, and so then it's finalized and ready by December 1st for our new cycle. So it'll probably, then I'll be doing a 2 presentation, like our finale of what we accomplished from our last 5-year cycle, and then what we'll be proposing for our new one. Blair, next slide, please. And I apologize, there's a lot of information on this next one. But if you'd like copies of the slides, then you'll have them too. So we've already gotten through laying the groundwork for the strategic planning. One of the things that I'm very excited about is we are going to be using Rush Copley as our partners who will be doing the facilitation. And they come for free. So we won't have expensive charges or anything for that. So I had a meeting with them a couple of days ago with our data and quality coordinator, and we're very excited to collaborate, and they will be attending all the meetings and facilitating, and we're helping them with the slides and talking to them about, the things that we need to hit on. And the good thing is they're already community partners with us, so they understand, the Kane County Health Department and the points that we need to hit. So, and they're making good suggestions. And so we're very excited to have them. So the groundwork is already being laid out there. We have all the points there, and our mission, vision, value statements, we believe those will stay pretty solid and the same. About 5 years ago, we did change the mission of the Kane County Health Department, and that was because it was really long and hard for people to remember. And so it became a shorter one 5 years ago. So the next thing that's very important is going to be the environmental scan, which we will be sending to all the key stakeholders. It'll be surveys, and we're talking about also some, it's not on here, but the, where is it on here? To have some meetings to get some more feedback from other stakeholders. We will look at looking at our strengths, weaknesses, opportunities, threats, and with the groups. And then what we do is we do a prioritization matrix, which is a quality improvement tool to look at and break out in group sessions. I hate to go into the weeds, but I just kind of like to overview of it. Once we have that, that's how we hit on the priorities. So at least it's within the group. And then once those priorities are addressed, then we start developing the high-level goals and objectives of each for the next 5 years. And so that will begin December 1st. And I'm very excited because we do have a new performance management tool that is actually used for public health. It's not like for a profit organization, because when we were shopping around, it was very frustrating. They were very expensive systems, and then they didn't quite match for public health. But we found one that is going to work for that. So we're very excited about that. And that's going to help us in our accreditation too for the next cycle, which will be in 4 years. So the exciting thing of this is we're going to just be starting a new community health improvement plan, 3-year cycle, because that's a 3-year cycle. And so it's going to be aligning like perfectly. So we're very excited about that. Next slide, Blair. Thanks. And so we have the timeline out. So we're done with the laying the groundwork. We will touch on the mission, vision, and values. And we'll beginning, the environmental scan will be more July-ish, but we'll talk about it in our meeting in a couple of weeks at the end of June. And then we'll be hitting the other, if we're lucky, we can get it done 4 meetings, but I don't want to rush it. So we have an extra one just in case we need it. So are there any questions about our strategic planning process or cycle?
Mr. Shepro.
Yeah, Kathy, how does the development of this fit in with the normal budget work at the same time? You just balance them? Are they going to be interconnected in terms of any changing goals or objectives that would come out of the plan?
Yes, so they could be depending on if one of the initiatives, if we want it to be, it could, and we could do it as a performance measurement. And if we want to do it that way. And actually, one of the initiatives that the health department had in our, like, in this 5-year cycle that we're on now was for, oh gosh, Canal, are you online? Can help me? I want to make sure I don't botch the actual initiative, is for expanding the financial resources. And so one of them I know for sure is, I can't see him on yet, but I mean, I see him there, but, so one of them was, which we hit the head on, which I'm excited about, was to bring back our MRC volunteers, which we did in the strategic plan. And luckily for us, we didn't know a pandemic was going to come along, but that expanded our resources, that we really didn't have the workforce, but it would have cost us a lot more in contractual expenditures if we didn't have the MRC volunteers. So we're so excited that we, brought them on as a resource, because we did have them before, but then they were gone. And so, that's just a invaluable resource that we were happy to have. So that was one of the things. And, so to answer your question, we could definitely do that. It just depends on what initiative we're going to go towards. So.
Yeah, one follow-up. At what point, I think I kind of lost a little bit of the train here. You mentioned that you're going to start off with the core group internal with input from Mr. Sanchez, Dr. Silva, and then you mentioned at another point that you would be, I think, breaking into small groups. Is this internal, or would this be at a point now where the board or other, I don't like the word stakeholders, but other participants would be involved?
Okay, so it would be within that core group that we would get the feedback from, and then we would use that data and feedback. And I should mention too, so also on that, we would get someone from IDPH and also our health advisory committee as well. So, but we will be seeking feedback from a lot of community partnerships. We have a huge list of information that we'll be getting from people.
How is that, would that involve for like public hearings or presentations or meetings or?
It would be, the environmental scan last time we used was surveys and then focus groups. So we could still do the same.
Thank you.
Any other questions or comments on this? Okay, thank you for, Madam Chair.
I would like to just drill down just a little bit as you're going through your planning.
Okay.
And I want to follow up with what Mr. Shepro was leading towards. When you do these strategic plans, you may have an effort that you want to focus on in the next few years. Hypothetically, let's say it's mental health or drug addiction, and you have a pie, right? So you would put a certain amount of money towards that one major initiative that you feel during your survey is of a critical need here in the county.
Yes.
If it's children's hunger, mental health, whatever it may be.
Yes.
So I think that's what I believe
Okay.
was being spoken about, which makes absolute complete sense. That's why you do it.
Yes, absolutely. And I can tell you, one of the things that I know is probably going to definitely be an initiative, because we already have feedback from our last reaccreditation. It was branding. So that's going to be one of the focus that we'll have for sure. So, because we'll have to show that we're improving on our King County Health Department brand and what we do.
Okay.
So, get there.
Okay, no more questions or comments? All right, we have an update on COVID-19, topic everyone doesn't want to hear about anymore.
Oh, well, Michael and Uche will be presenting.
Great. Good morning, everyone. Nice to see you all. And I would challenge you, Chairman Sanchez. I think this is the best COVID presentation we've ever given. So, and I've
Against your presentation.
We're all sitting here
So,
unmasked.
So yes, it's really exciting. Here we are in the middle of June. Buildings are open. People who are vaccinated are here. We're not wearing masks, as Director Foster mentioned. Things are really going in the right direction, and it's kind of nice that the sun's even hitting me right now, Jared, as we're talking about it. So we just have a few slides to highlight all positive news, what's happening here in the community. So this first slide is one that we typically show during our presentations. It's looking at how many of the tests for COVID are coming back positive, what percentage. And typically we show a 30-day chart, but this is actually a full year. And you can see where we are is the lowest that we have been. So right now we are floating just under 2% of the tests coming back positive. If you look at that peak back in November, 1 in 5 tests was coming back positive, and we were doing much more testing at that time. Now, just 1 or 2 tests out of 100 is coming back positive. So that is very exciting to see. The next one, we're looking at even more critical information where we see who's in the hospital because of COVID. And again, this is a full year of information that's presented on this chart. And you can see again that we are lower than we have ever been since the pandemic started to really ramp up. So this goes back into June, and we're significantly lower than we ever have. And I should mention on these charts, this represents Region 8, which is Kane and DuPage County together. But again, this is extremely positive news. And in large part, this is due to the hard work of everyone in the community who is working to get people vaccinated. Kathy mentioned our medical volunteers who've been fantastic. Our staff has been working tirelessly. We have tremendous support with the state through National Guard and contract clinicians who are coming and joining us, as well as many community partners who are really stepping up. So those can be pharmacies, our hospitals, our federally qualified healthcare centers. People are making vaccine available now that we actually have it, and we're seeing tremendous success with this. So the chart on the left is our daily average. So you can see, just like the rest of the state and just like the rest of the country, demand is going down, but we're still vaccinating a couple thousand people a day. So we're still making significant progress as we move forward through this. In the next few days, we should hit 500,000 shots administered to Kane County residents, which I think is a pretty exciting milestone. And you can see on the slide, it says 235,000 people, almost 236,000 people are fully vaccinated. But when we look at our population 65 and over 85% of the Kane County residents have had at least one shot. And for our population 16 to 64, over 58% of our population has had at least one shot. So the total population on here, there's always a caveat because that includes people who are not yet eligible for vaccine because they're too young. So those that are 11 and younger. So we're doing very well. We're in the top 5 counties in the state in terms of percentage of people who've had at least one shot. So that's very exciting. And we continue to push out into the community. So we have radio ads running, both in English and going to be starting in Spanish soon. And again, I think Chair Sanchez last month, because he's been instrumental in helping us craft some of the Spanish radio ad that's coming out. We have distributed over 6,000 flyers and posters and what we call palm cards to residents in the community to promote vaccination. We've also given out almost 50,000 surgical masks to families in need and organizations to distribute those. So that's really positive and exciting. We have a social media campaign going now, trying to encourage the 12 and over population to get vaccinated. And almost every week, we have new videos that have been coming online on our YouTube channel. Really each one targeting a specific audience in the community that we think may be hesitant to get vaccine. So another reason why this may be a great presentation, it's only like 3 slides for my part. So that's keep it short and sweet. But now I'm gonna hand it over to Uche Onwuda to share some of the exciting things that she's been doing, pushing out community clinics in Kane County.
Thank you, Michael. Good morning. My name is Uche Omuta, and I'm the Director of Health Protection at King County Health Department. Just a few slides about the community vaccination efforts we have around the county. Last month, I presented to you the program, the equity program, and today I'm just going to update on what we've done the past month. Our school vaccination efforts, we were able to vaccinate over 1,000 people in various schools around the county. St. Charles East, Dundee Crown, Larkin High School, St. Charles North NIE Academy. And these schools, all but Larkin High School, are having their second dose this week. Larkin's second dose will be next week. We've also reached out to the rest of the community, events in the community, farmers market, Swedish Days. There's a Juneteenth event in Aurora on Saturday, Milk Pail in Carpentersville. And also the Mexican consulate will be in Carpentersville today, Wednesday, Thursday, Friday, and we're already at Dundee Crown on today. Today's second dose clinic at Dundee Crown. So tomorrow and the next will be at the Public Works, same location as the Mexican consulate event. This flyer is one for the government center. We're vaccinating on Friday here at the North parking lot. I encourage everyone, let's lead by example. If anyone is not vaccinated, this is a good opportunity to come out and get vaccinated. It's convenient. People can come from their offices. We're also opening it to family members or anybody else. You don't have to show your ID. So anybody that needs vaccination that sees the van at North parking lot, just come on over and get vaccinated. It's 9 a.m. to noon on Friday.
I have a quick question.
Yeah.
You said that there's no ID requirement. Speaking to my constituents, it is a huge obstacle, the ID requirement. Folks have told me over and over again that they will not get vaccinated if they have to provide that. What I would look for is a flyer that says no ID required. I have set up with folks in my constituencies to drop them at our restaurants, our grocery stores, and they agreed that the taco trucks would put them in the bags with them. So I would love to have some flyers for that, specifically saying no ID required.
Yeah, that came up yesterday in our marketing meeting. We were discussing that. So those will be coming out soon. I was hoping to have something on that sooner, but yeah, so.
Yeah, so for all our vaccination clinics, no ID is required anywhere in the
Yeah,
county.
I expressed that, but if somebody can read that,
Yeah.
you know what I mean? That's a huge concern.
Absolutely.
It's consistent, so thank you.
I believe it's on our website too, on the canevax.org, that you don't need a ID, but the flyers, that would be helpful.
And it will be a major part of our radio ad that's going out in Spanish too on the lay. So hopefully we're going to start getting more and more information to target that.
Thank you.
So this
Mr. Shepro, you have a question?
Yes. I think it was in the last couple of days in the Tribune was a detailed article saying that there are still troubling pockets of unvaccinated individuals, a lot of which appeared to be socioeconomic based. I think it was done on a national report and not local to this area, but I wondered if how is that coming along here? And is that reflected in the choice of the vaccination sites to reach what still may be the under-vaccinated
Yeah, that is the idea.
portion, yeah.
Right. So the equity program actually, the purpose of that equity program is to address those pockets of unvaccinated people, places where people are unable to, like essential workers who can take time off to get to the vaccination clinic, those who don't want to go to the mass vax clinics because they don't want, they're afraid of, people in uniform. Transportation, there are several barriers that we are trying to address by taking the vaccination to the places where people go, the festivals, the park, pretty much any place where people gather, we're ready to set up a clinic there, even if we can get 5 people or 20 or 50 or 100. We're ready to vaccinate. And we're working with IDPH. Some of the clinics, the health department team is providing many of them. The IDPH team is assisting us with. We have a mobile site. We went out to Aurora Farmers Market on Saturday. We're going to Sugar Grove in 2 weeks, the July 3rd, Saturday, July 3rd, I believe is the date. So we're everywhere. Carpentersville, we've hit that many times. Yeah, so we've had that in mind as we reach out to the community. And Madam Chair has actually assisted us with some spots that she thought would be good for us to host events at.
A follow-up to that. Is there evidence that this is having a significant impact, or are we still kind of at a wall for a variety of reasons in getting these pockets significantly reduced? I see that we're, they're going to win free lottery tickets and so forth. Are we seeing slow, steady? Are we seeing, blitzing takes care of a community problem? What's the feeling about that?
And slow and steady.
It's
Yeah,
what?
slow and steady. Still, people are still coming in. It's just not the huge numbers we saw right away, but it's not continuing to just dwindle and dwindle rapidly as we started to see last month.
I guess the issue would be, does it appear that there will need to be a continuing focus on those areas? And is it their resistance? Is it their concern? Is it the problem with getting access to those people to get the message across? For example, the suggestion that some people might be afraid of anybody in a uniform.
Yeah, so it's all those things you're mentioning, and we're hitting all those angles because it's not just one big thing right now. It's just all these little things that contribute, and that that's what we're focusing on. So, Madam Chair.
One of the comments I heard with our factory workers, even though there has been a great deal of wonderful outreach to our factories here in Kane County, the hesitancy is the result of the shot. Some people, when they get back the very first vaccine or the second vaccine, they're fine. Other people, not so much. And their employers don't allow for that sick leave. They're afraid they would be docked in time because they would not be able to go to work the next day or the day after that, depending on where they're getting their vaccine. So this is a real problem for our hourly manufacturing workers. Authentically, they hesitate to get the vaccine because of that, even though it has become readily available to them. There's still fears, which are warranted. So that is something that each individual owner of that manufacturing plant would have to address separately, and also allay all of those fears. And that is something that's beyond our scope to do.
Okay, is that it on that portion, Uche? I know you have another thing on chronic disease, the portal presentation.
Yes, that's the end of the COVID-19 update. I can go to the next one.
Yeah, you can go ahead.
Okay. So the Chronic Disease Action Team is a result of community health improvement planning from the last cycle that Kathy just mentioned. One of the activities that we proposed was to create a chronic disease portal where people can go to get information about how to improve their health, especially as regards to the top three chronic diseases that we identified from that health assessment. So the Chronic Disease Action Team put together this chronic disease portal. Okay, so let's start with the video first, and then I'll show you the website. Blair.
Welcome to the new Live Well King County website. This website will give viewers information on how to find and access many resources throughout King County, which can help with enabling healthy living and with managing their chronic disease. Information on healthy living as well as the 3 most common chronic diseases are featured in this website: cancer, diabetes, and heart disease. Each disease page features an overview of the disease, like healthy living tips to minimize the risk of developing the disease, personal stories of individuals living with the disease, contact information for healthcare providers in King County who can help you in your healthcare journey, as well as some FAQs about each disease. The Healthy Living page provides tips and resources on topics such as nutrition, weight management, physical activity, sleep and fatigue, alcohol, and emotional stability. King County resources such as parks, trails, farmers markets, and food pantries can also be found on this page. Each page, including the disease page, features a side panel. Users can open the links on the side panel to connect to more information. For example, you can find here the Illinois Tobacco Quit Line and the 211 King County. The stats page provides high-level population statistics about cancer, diabetes, heart disease, and the healthy living activities of King County. By clicking Website, viewers will be directed to www.kanehealthcounts.org to learn more about how King County is performing relative to the state and the nation on this metric. Finally, our action team is comprised of 13 organizations who have been working collaboratively since 2016 to help address healthy living and chronic disease throughout King County. You can learn more about the action team's collaboration on kanehealthcounts.org. If you're interested in being part of the action team, you can request to join by clicking the button Become an Action Team Member. Thank you for visiting our website.
Thank you, Blair. If you click on the second link, that's the...
Hello and good morning. It is 10 o'clock Central European Summertime, and I have the pleasure to welcome you to this webinar on the Funding and Tenders
Forgot
Portal.
to introduce our other guest.
First quick question,
First, I'm
colleagues.
like,
Can
is
you
that
hear me
someone
well and can you see me?
We can see and hear you well.
I think the YouTube is still on. Okay, great. So this is the Live Well King County site. I encourage you to take a look at it, spend some time. There's good resources like the video said. We worked with DOT and development, and incorporated a lot of their information about parks and trails there. I can take any questions now.
Does anyone have any questions or comments about this? It looks pretty cool. Definitely going to check it out and let people know that it exists. So I think it's a good resource for improving people's health in the county. Madam Chair?
So this is just being launched now?
Yes.
And you're going to track how many hits you've had and what pages people are lingering on?
Right.
And how are you going to share this with everybody that the population that it's out there?
So we're creating palm cards to drop off. We had a press release already on it, and taking advantage of some chronic disease related events to send out more information. Social media, our PIO is working on those as well. So,
Okay. Thank you.
I just want to say good job. Looks great.
Yeah, it looks really good. Good work.
Yes, thank you.
So, okay, thank you, Uche. We do have a couple resolutions. If I could get a motion in a second for authorization to enter into grant agreements. Anyone want to take a stab? Mr. Shepro?
Yes.
Silva,
Strathman
second.
seconds. Okay, these are, Kathy, can you just briefly describe what the grant agreements are? I can't remember off the top of my head.
So I believe this one
can't
is
hear
that
you.
umbrella grant.
Yeah.
We call it the umbrella grant. Oh, yeah, it does even
I'm
say-
sorry, I can't hear you very well.
Yes. So this is the umbrella resolution that, because in the past, I think we used to do all our individual grants. We would bring them individually. So this is more of a blanket resolution so we can enter into our grants with the state. So we just started doing this, I believe, a couple of years ago. And I don't know if Canel's on, that can explain that more.
Hi, yeah, this is Canal. On the executive summary, we try to bullet point it to explain the basic points why we do this. It's mainly for timing. The state does not operate in the time frame that we need them to operate, to take into consideration our review process that has to go through the board to get approval through the various committees before it goes to Madam Chair to be signed, which takes about 45 to 60 days thereabout. They usually want these things turned around in about 30 days or less. The risk to us is to lose those funds, and that would be a significant hit to the health department, but more importantly, the county, in being able to operate the programs. So in working with the state's attorney's office years ago, this is what the solution that was suggested was to do a quote unquote umbrella grant that listed all of the grants that we would be entering into, which most of them are reoccurring, and then have that resolution pass, go through the board process, giving the chairperson the authority to sign the grants and accept the funds. So this is really just accepting the funds that for the grants that are basically, most of them are just reoccurring grants.
Streamlining our housekeeping, our bookkeeping for these and approval. Any other questions or comments on this, Mr. Shepro?
Happy here.
I'll defer to.
I agree with the process. The list is quite impressive, but there are no amounts listed here. And that's something that at some point in time we should have. When will we have the amounts?
Well, absolutely. We are in agreement with that. But since the award amounts have not been determined at this point, the line we put down at the bottom in requesting is that the county is able to accept the maximum amount that's being awarded, because the actual expenses for us to spend are part of the budgets and grant agreements that actually get signed, and that basically goes through the regular process because it's built into the county's budget, which everyone gets a chance to review and determine how it gets spent.
I understand, but when will the numbers of the grants be reported to the committee?
When we get it.
When it comes in?
Okay, so we'll get that each month based upon the acceptance of the individual or the granting of the amount.
Well, these are in your financial reports, right, Canal?
Yes.
money that we get from the grants?
Yes, and built into the budget is the budgeted amount that we expect. The actual amounts will get reported out in terms of the receipt of the funds.
Okay, thank you.
Mr. Shepro?
I was actually going to bring up the same point, but in the past, and going back almost 20 years, we had the same problem that the staff has alluded to, which is they operate on a different cycle and it's not designed to work with our committee structure. I would say, I haven't looked at a lot of them recently, but I used to have to review every one that came in as the attorney before it went to the chair for signature. The one thing I could tell you is that every one of them has the infamous language about being subject to prior appropriation, which means if the General Assembly doesn't appropriate the money, it doesn't matter whether they sign the agreement. I suppose the concern that I have is because, I mean, frankly, as was pointed out, the grant, we get administrative costs as part of the grant, but are there any grants that we get that are subject to a match with local funds? Because that would be something that I would think we'd want to know. You know, say you got a $2 million grant, but you got to put up $1 million to match. And so I continue to not love the process of a blanket authorization, but I don't know practically that there's any other way around it. But I guess my question remains, are there grants that we have been getting that require us to match it or supplement it from our own funds? Because I think that would be something that the committee would want to know.
Okay, well, maybe that's something we can follow up with at another meeting. We're running a little low on time today. Madam Chair.
Just a clarification, shouldn't, Ms. Foster, shouldn't that be part of your budgeting? Because you would have anticipation, if these are historic grants that continue, that you would know in your budgeting process, to Mr. Shepherd's point, if you're giving a $2 million grant and they're asking for a $1 million match, that would have already been budgeted because you would have anticipated that additional expense to go towards that program.
Yes, correct. Canal can verify.
That is definitely correct. And just to go back to the other point is that even though the umbrella grant gives the chairwoman the authorization to sign, we still go through the vetting process in terms of having the grant agreements reviewed by the state's attorney's office. We send them all over so that they can review them to ensure that the language is appropriate for Kane County.
And if there were a new, entirely different grant program, that wouldn't be covered by this.
Yeah, so
we
that would
listed
come, that would come
specifically,
before us
so
again.
that would come to the board. So, okay, that satisfies my curiosity. Thank you.
Okay, no other questions or comments. Clerk, could you please call the roll?
Lewis. Shepro.
Oh, Shepro, yes.
Strathman. Yes. Leppy.
Yes.
Silva.
Silva, yes.
Thank you. Sanchez.
Yes.
Passes.
Okay, if I could please have a motion and a second to discuss and pass authorizing budget adjustment for COVID-19 contact tracing services.
So moved. Strathman?
Strathman moves.
Deputy second.
Silva,
Deputy
second.
seconds. Okay, Uche, did you have something on this?
So this is just continuing the contact tracing services that we had from previous. We have the funding.
Microphone, please.
Have additional state funding.
That one's not working. It's still not working.
Sorry, I turned it off.
I figured that out too.
So we received additional funding from the state to extend the grant to December 31st. December 31st.
So this is us accepting more money, a pretty easy vote.
This is an adjustment to get more money, accept more money from the
Yeah.
state.
Any questions or comments? Hearing and seeing none, clerk, please call the roll.
Lewis, Shepro,
Yes, Shepro, yes.
Jasmine,
Yes.
Pepe,
Tepe, yes.
Silva,
Silva, yes.
Okay, that passes. Old business, we have nothing for old business reports placed on file. Do we have a consensus? Unanimous
I would
consent?
ask unanimous consent to place the reports on file.
All right, any objections? Hearing none. Reports are now placed on file. No need for executive session. I have nothing for new business. There are no public comments. So can I get a motion and a second to adjourn?
Shepro seconds, Mr. Kenyon moves.
An honorary vote by
That's
Mr.
true.
Kenyon.
I'm so used to Kenyon. I'll move to adjourn.
Shepro moves, Strathman seconds. All those in favor, aye?
Aye.
All right, we are adjourned. Thank you.
I
Kenyon's
like
not on
the
this committee.
brochure that had outside Spanish employees.
Mhm.